I have young people that I work with where I speak to the family at least once a week, and that's to provide them with support as well. See, as someone like you, like you're a unicorn sat in the room, and families often are so grateful to have immediate access to that, and yet it is just part of what we offer, so we're lucky to have that here.
So it's quite unique to have an on-site therapy team in a children's home, and I think people are often quite curious about what we offer and what we provide. So can you give us a bit of information about what we do within our therapeutic offer and how we support young people and families as well?
It's a really good question, and we get asked it a lot, and actually the answer is not as linear as you might imagine. So what we attempt to do is a thorough assessment as a therapies team across the board. So that might be the occupational therapy needs, it might be the psychology needs, it might be their dietary needs, it might be their speech and language therapy needs, behavioural needs. So we work as a whole team, and we put the emphasis on within the assessment as to where the support is needed, what the needs are, and try and fit that. So it's quite individualised. It's very child-centred, but we also appreciate that the children are existing as part of quite extensive and complicated networks sometimes because they've been in care before, they have relationships with key family members, and what we would like to do is also involve the families within the work, because they have key insight into their young people, what's best about in terms of meeting their needs and supporting them going forward, what their wish lists are as well. So often families will say, I never managed to get an OT referral, I never managed to get, see, as someone like you, like you're a unicorn sat in the room, but you're there to help their young person the best way we can fit in and try and provide an assessment, monitor aspects of behaviour. So we might be looking at their ABC charts. Within SuperCare, we have an embedded approach to always recording any events or incidents that occur within the ABC frame. So lots of people might not know what an ABC chart is, but it basically looks at what's happening before a particular behaviour. So what might be the triggers, what the behaviour might be. So it might be hitting out, it might be getting super distressed, it could be anything, but something you're looking to try and change, or looking to try and monitor, reduce the frequency of. And then what the consequences are, so that's the C, looking at what happens as a result of the behaviour. Do people back off? Do people sort of lean in and give support? And is it a way of pulling people to us? So we do a lot of that work. So that might be a really large part of any assessments that the likes of you and I will be doing. But it's only one part. So we'll be looking at holistic needs. We'll be looking at a young person's movement or their occupational therapy needs. We might be able to help them by doing sort of language assessments, look at their speech. And families often are so grateful to have immediate access to that, and yet it is just part of what we offer. So we're lucky to have that here. But also it's the young people's right to be able to access that support, and for us to be able to give a decent assessment and think about what their needs are so that it can inform our next steps in terms of intervention.
And can I ask, what would your work look like with families? So you talk about involving families in the assessment process, but do you do any work with families after that?
It really depends on what the families want and need, and some families want to be incredibly involved in the care planning and hold parental responsibility throughout, so PR, throughout the duration of their stay with us, and we would want to involve people, we would want to involve parents in their child's care as much as possible. I have young people that I work with where I speak to the family at least once a week, and that's to provide them with support as well, so that, because for some of our parents this is the first time their young person has come into care, and we acknowledge and appreciate that that's also a transition for them to make, and possibly quite a difficult step to take, and that requires its own support. So we do that work where needed.